So when we're talking about squat mobility, one big thing, one limitation that we see is that ankle mobility. Commonly we see good mobilizations for ankle dorsiflexion, that's moving the ankle up and down, but what we don't see and what we have a lack of education on is tibial lateral glide, and that's how far the tibia can move on top of the ankle. So we're going to use Jessica as an example to show you what that is. So she's going to lie on the back, the foot's going to be bent up just like this, and what we're looking for is the foot to stay still and how far that tibia can move over. We're going to use a reference as the knee. The knee is the tibia plus the femur, so that's going to be a good indicator of what's happening. When you're testing yourself, I want you to stabilize around the foot below the ankle bones. You're going to stabilize there, squeeze and push down. Take your hand on top of the knee, and as you stabilize the foot, see how far that tibia can move out. So what we're looking for is this angle and how much that changes. So Jessica has really good motion here. Most often though, any powerlifters, crossfitters, or weightlifters in general, you're going to have a lot of mobility issues there. So why is that a problem? That doesn't look like something we do during a squat. Here's the problem with that. As we're squatting down, our cue with the toes out a little bit, our cue is to tighten the hips to turn out the knees as we drop down. So as we're dropping down into the squat, what we need to do is we need to have that tibial lateral glide so the foot can stay down and the knees can come out. If we don't have that motion, this is what happens. We squat down, drive out, and the toes come up, or we put too much strain on the inside of the knee, or we externally rotate the feet as we're going down and we come into pronation. None of those are good, and all of those can lead to two things. They can lead to pain and injury, or they can lead to lack of performance. Neither of those are good. So we want to fix that. The question is, how do you fix that? It's really hard to come in here, stabilize, and mobilize yourself. So what we're going to do is a banded mobilization to get that mobility back. So this is thicker than the other ankle mobilizations that we do, just because we want to stabilize the foot very, very well. You're going to grab the band, put it around your ankle. Remember how we tested? We were below the lateral malleolus, so I want that band all the way down there as deep as it can go. And then put some good tension on the band. You don't have to use a wedge like this. It does help a little bit, but if you just are on flat floor, it's going to mobilize just the same. Make sure as you do this, your foot stays down. The big toe and that the ball of the foot should stay down. All you're going to do is come over the toes to the outside, just like that. Come back, go forward and in. What you should be feeling is a stretch or a mobilization on the inside of the ankle as the tibia moves outside. So for these mobilizations, you don't have to hold it too much, maybe a couple seconds, and then back off. So band around the ankle, below the ankle bone. Band's pulling across your body. Knees coming forward and out. Feel the stretch on the inside of the ankle. Hold for 2 seconds and then back off. Set a timer for about 30 seconds. Go through that. Once the 30 seconds is up, take a break, and you're done.